hear from you about role of lifestyles in promoting health.
Okay, thank you. Now, when you talk about the lifestyle and health promotion, it covers most of the health issues of the country or a family or a society. When we discuss the term health promotion itself, it is a wonderful word. It comes under the primary prevention of health issues. When you take the levels of prevention, there are levels: primordial prevention, primary prevention, secondary prevention, tertiary prevention. When you take specifically primary prevention, there are two major strategies on primary prevention. One is health promotion, next is specific protection. When you take specific protection, it is more towards the communicable diseases. When you talk non-communicable diseases, we talk more on health promotion. Actually, it is not a word. It is almost as a big process. It is not even as a health event. It is not just talking to the people. It is the place where we want to change their behaviors for adapt their new healthy lifestyles. That's a fundamental knowledge on health promotion. Health promotion now it has become a university degree on beyond. It is not just a course now, it is a degree program. It has very well established universities as a health program, degree program on talking health promotion. What is the actual purpose of health promotion? To promote the health. To whom? All the people in the society. When we discuss it in detail, this health promotion has its own action areas. There are 5 action areas developed from the Ottawa Charter. This health promotion was initiated for the world in 1986 in the Ottawa Charter, Canada, and they developed some action areas. It was evolving into so many things. There are strategies, there are settings. It is subject matter. When you consider it's a practical aspect, we want to promote health. How are we going to promote health? We want to empower the people, develop new skills, create an environment, tree-oriented program. These are the major action areas. Then we want to do a developing active participation of the people. With the people, we are trying to modify or change their behavioral patterns. Then when we discuss the behavioral or change of pattern, those are the determinants of health. Generally speaking, those are the factors which influence health-related activities, health-related behaviors and health-related knowledge. Then all this can be changed through this process called health promotion. When you compare the health education and health promotion, health education it only promotes the knowledge part. It is just a knowledge part, imparting the knowledge. But health promotion, it is not that. It is going to change the behavior. It is going to be activity. This activity, this health promotion, we can make it further into the positive approach. How we can develop the lifestyle. As we all read, most of the lifestyles are becoming risk factors. When we adopt good or positive factors, we are going to reduce the risky area or a vulnerability of the factors. When you talk NCD, there are major lifestyle factors, healthy eating. Then when we can promote the healthy eating, that means we are promoting health to prevent diseases, not only diabetes, hypertension, dyslipidemia, malignancy, asthma and any sort of chronic diseases can be prevented through healthy eating. Then healthy eating promotion we can adopt from the childhood, adolescent and even for elders. Therefore, health promotion can be promoted from any level of age group and any category of people, but we are at the point to promote the health. Their lifestyle can be changed. To promote the lifestyle, we should understand the root causes. What are the root causes? Those are the determinants. Actually, the patterns on their daily living. The time how they wake up from their beds, how do their worship, and how they have their prepare meals, and how they are consuming their meals, and how they can develop something on the related to the food. If the food things are not adapted, then they become to consume unhealthy products. Unhealthy products are going to be the major risk factor for NCD. That health promotion start from our home environment. That is the fundamental developing health promotion strategies from our family setups. How we can develop a settings, almost a community setting, how to develop a good eating habits, how to prepare good products, and how to even market or commercialization of the food product. Then health promotion start with the food. Similarly, the physical inactivity, another major risk factor, that is we call exercise. Exercise is also part of the physical activity. If we can promote good physical activity, we can develop a very good physical changes in the body that will lead to a healthy environment. Then physical activity also another risk factor that can be adopted. Then when we go where we can develop the physical activity, it can be developed from schools, even communities as well as institutions and beyond. Then when you develop the settings, okay, if we want to promote health promotion as a community setting, we can develop a settings of community for promoting physical activity. If we can develop a community-based activity to promote physical activity, it will definitely improve the physical fitness of the individuals and the children. When they develop good physical fitness, it will definitely improve their mental status. If they are mental and physical altogether, their personality will go. When we go detail of this physical activity, it can increase the blood flow to all organs, all tissues, and they become healthier. Then they can have very good mental status. Then they can develop they are strengthening the muscles, bones through the exercise. Then they can reduce the risk factor of obesity, which is going to be another risk factor, is connecting the food and exercise. Then obese, is going to be the major risk factor for normal disease, diabetes, hypertension, dyslipidemia. Then when you talk about two habits, eating habits, exercise habits, these habits are determinants. When we promote these two habits, we can promote a better younger society with two major simple factors can be addressed from any level, from the childhood, schools, primary school, secondary school, even universities should develop a program to promote the health for their well-being. This is two major factors. Similarly, when you talk the promotion of relationship, health relationship have very good impact on social life. How can we develop a relationship? That is also promoting good communication skill, improves their health literacy. Health literacy and health communication can improve their healthy social habits. Now, when we can have a healthy communication or healthy communication club or healthy clubs that can promote the healthy communication channel, it will give an important message on generally on domestic violence, alcohol misuse or alcohol abuse problem and substance abuse, and so many social activities can be promoted through this science of community healthy communication or healthy improving the health literacy. Then this also part of health promotion. It is like a prescribing drug on a medical expert or specialist prescribing drugs for medicine. But we can prescribe this packages for, okay, this package is for improving the knowledge, improving the skill, improving their knowledge and attitude. All will change their behavior and how to behave and how to prevent this disease. Therefore, health promotion is one of the platform in the disease prevention. Rather than we develop diseases, we can arrest the progress of the disease through active taking part of the promoting and applying the strategies already well established in the system. Advocating the people, mediating the people, empowering the people, developing new skills, developing new policies, creating supportive environments and reorienting the existing policies, all will work together for their better promotion. Then lifestyles, health promotions is very closely linked for the social well-being. When we go detail, school environment, one of the determining factor for the health, preschool, schooling, home environment, socio-economic status, occupation, sexual life, leisure activities, all are interconnected with the day-to-day activities of the society. Then when the society is well known, well aware of these root causes for health, that is we are bringing a better healthy society. To promote the health, we have to know what is health promotion. That is, we are inducing the people to take over the control over the determinants or influencing factors of their health. That means we are promoting health through empowering them to understand and making more and more responsible person to take their duties. They are making people to aware. That is how making them to understand. If they can understand the roles of the people as well as the roles of the healthcare professionals and the role of the government policymakers or the government even politicians, they have a big role on changing the policies and the factors. When we want to make a change, it can be starting from top to bottom approach, it can be from the policy level, it can be in the root of individual level. Therefore, even though we talk individuals just for a discussion, health promotion is focusing on people. It is focusing on people and focusing on the communities. That community is a model. When there is a community, they adopt some common features of culture, common features of habits, they live on common resources, and they have a particular demographical background, and that particular society will rely or they will depend on their factors influencing their health promotion. Their health promotion, it is the must, and it should be understood and explained to people to adapt in the future. Health promotion is almost, it's not much expensive, but at the same time it is not attractive. As it is not attractive, people are not ready to adapt to the style. If it is a clinical setup, people jump to the hospital, they pay more money, they spend more time, they do unnecessary investigation, and they recover from the health-related diseases. But when you talk the health promotion, they are within the community, the risk factors are there, determinants should be addressed properly, then those people can have a better life, and they can avoid going to hospitals, or they can avoid becoming more and more complicated problems. That health promotion will help people to prevent mainly the diseases, and also it will promote their very good family relationship. If the children are happy, if the children are healthier, the schooling performance will be better. When the school children are better, then the society will have very good intellectual children. That will give a very good resource for the national future development. Then it all are interconnected. Then when we don't address the basic factors as determinants, and those are the factors going to influence the lifestyles, these lifestyles are based on the activities and the programs. Those are covered in the big term health promotion. Health promotion should be one of the major important area in health related institute. Unfortunately, leading hospitals, they do not prioritize the health promotion activities. They just keep on writing some leaflets and informing this is health promotion. No, health promotion should make a change, behavioral change, communication. They should change the communication. Part of that health education comes within the purview of health promotion. Health promotion is a broader area and it's a broader goal. It's a social determining factor where this disease can be prevented, and disease can be prevented with the prevention that can be promoted. Then we can save the money. You can see the current system of our country. We spend more money for diseases, but we spend less or no money on prevention. But current government policies now towards the primary care strengthening. With the primary care strengthening, we should have health promotion institutions, health promotion clubs, health promotion units in any part of the health institutions or any educational institution. Ultimately, it is the way to educate the people to change their habits and lifestyle. That will lead to a better community development, improving their health literacy, health communication as well as standard life-based skills. Empowering them through developing new skills, it gives them a new opportunity. Then active participation of people will encourage the people to do new things. There are new things, new development will have a new era of unhealthy habits will be eradicated. We can promote the healthy living people and we can promote the health irrespective of the age group. Even we can talk about the elders, we can talk about the middle age group, we can talk even children, we can even talk the antenatal mothers, those who are going to produce good children to the world. Their promotion can take place from any spectrum of the people, from the fetus inside the uterus, or it can be an adolescent or even the elderly population with the terminal illness. Health promotion can be adopted in all levels, understanding the basic fundamental principles lying with the concept of health promotion. Health promotion cannot be excluded from the health process. It is the part of the health management system. But getting the knowledge is not important. Application of knowledge becomes more and more important. Therefore, health promotion is an application tool. We have to apply health promotion strategies, health-related things for more and more empowering people to take the message on empowering people. That means taking their responsibilities of their own health. If they can take their health, if they can stop smoking, if they can do good exercise, if they can have a good meal, if they can develop a good mindset, if they develop a good working place, if they can find a very good home environment, then health is there. We don't want to seek the health. It can be better selection if they can understand the health promotion processes. Health promotion is a process. It can be adapted from any time or point. Yes, we can say how they are going to live. This life based on factors we call lifestyle model or lifestyle mechanism. Then we think about the lifestyle modification. When we can modify the lifestyle, that means we want to change the behavior related things as well as attitude change. Both will become a good person to adopt a healthy lifestyle. A healthy lifestyle will lead a healthy life. Then to lead a healthy life, to diminish the risk factors, we want to promote health promotion. Health promotion is the fundamental or the pillar of health rather than talking about the disease and management. We do not concentrate on health promotion. Why we are attracted the system of disease management rather than promoting the health. When we go further, we can think that this wellness program prior to the health. Therefore, the wellness and this health promotions are closely related, and we can develop a better healthy society, adapting the so-called the name health promotion and follow the systems, that strategies and their accepted settings. This is the needed topic and needed things should be adopted. Mainly it should be a given big task among the medical professionals, especially among the medical graduates, to understand the concept of health promotion before they become doctors, those who are going to practice medicine. To promote them, when we promote the health, we can practice health practices that will promote their life. That's it. We started at 12.